DESIblitz.com.
Hi there, I'm Andy Street, Mayor of the West Midlands, and you're watching me on DESIblitz.com. Of course, the overwhelming priority has been to lead the region through the battle against coronavirus. And be clear, I don't do lots of things myself in terms of the different agencies, the health service, education, councils, they all do their stuff. But I have seen my role as the sort of glue in the middle of it and making sure citizens really understand what's going on and what's required of them. So there have been some tragedies in Birmingham. We know that there'll be families who are still mourning the loss of a loved one, and whatever I say, we can't in any way escape from that, and the virus has hit us very hard. But I do think that we've seen two things that I think have been incredible, actually. We've seen so many community organisations rise and think about what they can do for their communities. And actually, we've seen some incredible service from our public services, whether it be the NHS or whether it be lots of other public servants, transport workers all playing their role, schools all playing their role. And I actually do feel incredibly proud of how Birmingham has come together to fight this virus.
I think you're very correct in saying that everybody has come together, and it has been a very, very difficult time. There's been a lot of pressure on the NHS. How closely have you been working with the NHS, because they are at the front line of COVID-19? They must be under extreme pressure.
Extreme pressure. And it's only right, the first thing to say is thank you. Just to pause and reflect just what an incredible job they and many, many others have done. I'm in close touch with all the hospital CEOs. I think they'd be the first to say, sometimes they ring me up and say, Andy, we need to sort this out. You need to know this. And I can't in any way step into what they do to lead those organisations. And I've got huge respect for the leaders of those organisations. But I hope they would say that I've tried to support them through some practical matters as well.
Do you think we were quick to respond to the pandemic from a West Midlands perspective?
So that's really, in a sense, it's a national decision as to when the lockdown occurred. But if you think of some of the things that had to happen here, I'm actually very proud of how they happened. So let's just take a practical example I'm directly responsible for. A lot of emergency workers relied on the transport system through the toughest of times. Did it continue to run despite all the sickness and all of that? Yes. Was it clean, safe? Yes. Did we run a free service for NHS workers? Did we run shuttle services from some of our stations to our hospitals? Yes. So actually that's a lovely example of we responded immediately. It was done literally in the first few days, and I think that type of example has been brilliant to help the front line, actually. And then if I think as well about how our councils responded, getting cash grants out to businesses when that was needed, they were, on the whole, they did an incredible job getting that money out the door. Some were slightly faster than others, of course, that always happens, but there were some really incredible responses that people made, actually, yes.
Do you feel enough has been done for the BAME communities? Now, if we take the example of DESIblitz, we've been at the forefront in terms of our coverage for COVID-19. We've been translating some of the key messages from the government in Urdu, Hindi, Punjabi. Is enough? Has there been enough done for the BAME communities?
So let's be honest here. There are some brilliant examples of things being done directly for the BAME communities. What you've done, your translation work is phenomenal. What a lot of the faith groups has done has been phenomenal as well. But you stand back from it all and you say, let's look at the mortality figures, the death figures, and there is an unequal effect. And so you have to say there's something deeply, deeply troubling that there has been that unequal effect. And in that sense, you have to say it wasn't right that there was this inequality. So what we've done to lean directly into this is we've looked at what we being the combined authority, have done this important report that we call the Regional Health Impact of COVID, looking at these inequalities. Why was it? And most importantly, what can we do about it going forward. And please, that's available for anyone who wants to see. It's a very, very honest report, pulls no punches, talks about the different death rates between different communities and what were the underlying factors.
Talking of the BAME community, South Asians are a high-risk group. What kind of support is available for them, especially those who've been deeply impacted by mental health?
So you've done great work. For example, all of your translation stuff, there's materials through the Asian Business Chamber, particularly to help people leading South Asian businesses. But coming particularly to your question, we know this issue of mental health has been huge in all communities. So a resource, I would say, is immediately available. Anyone feeling, I'm really stressed by this, how am I going to cope with this? All the work that we call in the Combined Authority Thrive at Home, all available online, just to give some helpful tips as to how you would manage your own mental health. And another example of managing mental health, addressing that and then getting people into work who've suffered long-term mental health issues. The programme Thrive Into Work just announced 600 people into jobs in the Black Country over the last period through that programme as well. So there are specific programmes around managing mental health.
Okay, moving forward, economically, Brom's South Asian businesses contribute immensely. What will be done for those businesses which are not able to survive? The wedding industry, the hospitality industry. And when we talk about the wedding industry, we're talking about caterers, we're talking about bridal wares, we're talking about venues. They continuously, till today, are suffering. What can be done?
So the hospitality industry as a whole, first of all, we know that's suffering incredibly, actually. And I know the South Asian contribution to the hospitality industry across the West Midlands is huge. As you say, it's immense. So what I've been trying to do is get additional support for this industry. We were successful back in October where we got the grants for Tier 2. There were no specific grants for Tier 2 before, and I hope that lots of businesses took advantage of those for the period we were in Tier 2. What we're now arguing is that grants are completely insufficient. So I and others, and I've been on radio, television, newspapers, you name it, to push the argument to say we have got to have further support for those businesses. And the critical argument is they're viable businesses, they're good businesses. We need them to be here when we come out the other side so they can continue to employ literally tens of thousands of people across this city and region. So that's what we're doing there. Now, on the weddings piece, this is tough because obviously I'm acutely aware of this. I did a round table with some of the venues earlier in the year. I've had lots of lobbying on this. But the current rules are that weddings are limited to very small numbers and the wedding venues cannot open. So what we're again arguing is for those who are forced to close, there should be particular support for that sector. All I will say in my defence is I picked up that, you can have the letters of where I've been communicating with government ministers saying the wedding businesses have got to be given clarity about when they can reopen at scale. Now, of course, we've now got much, much more intense restrictions, and I think everyone would understand that all are suffering the same restrictions at this time.
Okay. Jobs-wise, how will the region's young be supported to have prospects going forward?
First of all, we've launched what we call our youth platform. Now, what that does, it sounds a bit of jargon, but it's really important. If you're a young person thinking about your prospects, you can actually have a look at all of it in one place. Just go online, youth platform, and you'll see all the training offers, the careers advice, all of that in one simple place to understand. Secondarily, there will be drop-in places in each local authority where you can go physically for that, called the youth hubs, but then there are specific schemes as well. And a brilliant scheme I would just call out at the moment is what we call our sector-based work programmes, where we're working with those sectors of the economy that are growing, like construction, digital, healthcare, and our colleges, to say what programmes are available to get people the skills for those jobs in the growing areas. And if you go along to the Department of Work and Pensions, if you are facing unemployment, they will then put you alongside one of those schemes. And then lastly, of course, there's the Kickstart scheme. And I was lucky enough to see youngsters at Tesco's just a few days ago, where they've taken on a think 1,000 people is their commitment. Severn Trent are going for 500 people. And if you're a business, I would say, please come forward and give a Kickstarter a new opportunity.
How can the Birmingham BAME communities help you?
3 things. If you're a BAME business, think about whether you can employ somebody else. Now, I know it's tough if you're in one of the difficult sectors, but there are growing sectors, some brilliant professional businesses that are led by the BAME community. Can you take on one of these young people for training? That's the first thing you can do. The second thing is you can actually spread the message through your community about getting the vaccine as soon as you possibly can. So I'd urge everybody that when you get the invitation to come and have it, you go. And that is irrespective of your background, your faith, whether you're a vegetarian or not. The trials are absolutely clear that it will be beneficial to the huge majority of people. Don't be taken in by all the rumours and scaremongering on social media. Go and look at the facts from the NHS about this. We hear that there are all these anti-vax stories. There's nothing more powerful to deal with these stories than someone you respect in your community actually telling about the lies and damn lies that these anti-vax stories are. So please, I'd ask that. And the third thing I would actually say is step forward and play a representative role. Now, that might seem a little distant at the moment. It's what we've been trying to do in the Leadership Commission to encourage that. But actually, it's very important to what we're talking about. What's been reflected about how this virus has impacted different communities in different ways. We need more people from BAME communities in leadership roles so we really face in to those underlying issues. Please do your bit. Make yourself and all of your community safe for the future.
Andy, a bit of a tricky question, but how closely have you been working with the opposition?
It's not a tricky question. It's a very important question. The answer is very closely. And I think that's something we can be really proud of here, that we've come together cross-party. So we do, in this very room, every Friday, a media briefing. There's myself, there's the Labour Police and Crime Commissioner, there's the Labour leader of the City Council, but we do it together because there's something more important than politics, and that's about leadership.
Looking back on how the pandemic has been handled, would you in your capacity have handled things differently?
Of course you do some things differently. Probably nationally there are 2 things that stand out. The first, of course, is the whole question of the policy with care homes in the first lockdown and people being discharged from hospitals into care homes. I think we all now accept that that was not the right thing. And then the second thing was that it actually took us some time to be honest about the differential impacts on different communities. I'm a huge believer in being honest with anything, because if you tell people the truth, they're likely to do the right thing about it. And I think we should have been quicker to be clear about what was going on there.
What lessons were learnt from such a pandemic hitting this region, the West Midlands?
So I think there's 2 lessons I draw out. The first, because you couldn't prepare for it, so how we responded to it gives the lessons. And I think the first lesson we draw, and this sounds a bit dry actually, but it's true, is that we get very excited about the new parts of our economy. You know, the health research and the electric stuff and the 5G and all of that. But actually, what we learn is a huge number of people are employed in really the most reliable, foundational parts of the economy, like the hospitality part of the economy that's been hit very hard. So I think everybody's really come back to where are the huge number of jobs and where are jobs vulnerable as well, and we need to think about that in the future. And then the second thing I think we've learned is this piece about how faith organisations, community organisations, voluntary groups, all of them play a critical role as well. And in a sense, they're probably the 4th emergency service actually. So we've really seen and relied on them.
Thank you, Andy. What are your priorities for 2021?
2021, the priority is one word actually, jobs. Coming into this pandemic, the West Midlands was doing really well as an economy. Probably never had better prospects for young people here. Record employment levels, but we've seen unemployment double. during the pandemic. And we've got to work incredibly hard together now. It's a sort of regional, national mission to give opportunities to our young people in particular. That's the challenge.